I go to the gym every day. Why did it happen to me? I eat healthy every day. Why did it happen to me? I wake up in the morning. I don't eat outside food only. Why did it happen to me? Cancer is not a sudden disease. It doesn't grow suddenly. It doesn't grow overnight. Suddenly it comes. Hi, I'm Dr. Prajyoth Reddy. I'm a plastic and a reconstructive surgeon. You guys must be thinking, why is the plastic surgeon talking about cancer? So I specialize in cancer reconstructions. So I reconstruct the cancer that has been removed, the part that has been removed. When I'm talking to you about cancer, it's a different perspective. You see an outside perspective, not an onco-surgeon's perspective. So let me tell you in my language how the cancer begins. So imagine our body has multiple workers like any other factory or anything. It's built with a lot of cells. The cell is a structural and functional unit of our human body. So multiple cells make millions, trillions of cells make a human body. And these cells, they can be blood cells, they can be skin cells or any cells. Every department in our body has its own cells. So these cells are all controlled by a body intelligence. Like how a country is controlled by the governing body, like that our body is also, regulated by an intelligence. So these cells, for example, cells in the skin, cells of the finger, cells of the hair, they are programmed to grow in a specific manner. So when these cells get a program, like for example, they tell the cell of the finger, boss, in my genes, I have a certain height to achieve. So the cells get a program saying, boss, you have to grow only this much. So the cells grows and then it stops. So it has a signal to start growing and it gets a signal to stop growing. Like that, same thing when we get hurt, when we fall down, we have these wounds. So the body gives the cells there a signal, boss, there's a small wound, come on, you guys work hard and cover the wound. So they keep working hard and covering the wound and then, eventually the wound heals. So there's signals, there's communication between the intelligence and the cells to do the specific job. So what happens in our daily life or in this kind of lifestyle, smoking, alcohol, tobacco chewing, stress, eating habits, radiation, all of these are all causing, regular changes in our body. So damages to the cells. So what happens? It gets signals, you're damaged, do it again. You're damaged, repair yourself. You're damaged, repair. Like lungs, oral cavity, whatever, any part of the body is damaged, they repair. So what happens? Suddenly the cell goes rogue and the DNA is the main governing body of the cell, inside the cell. So what happens? Suddenly the DNA says, no, I'm not listening to you. Or it gets a signal which is not very good because there's so many signals going, it doesn't receive the signal very well. So what happens? This cell just grows. It doesn't get a signal to stop. That is when it forms a mass. I got a hurt here. Everything has healed. Again, I got a hurt. Everything has healed. So it's getting signals, stop, grow, stop, grow, stop, grow. And then one day, one of the cells says, I'm not listening to you. And because of stress and all, that cell doesn't stop growing. So as it grows, it becomes a small mass. Now this mass, if it just stays here, it is called a benign tumor. We won't call it cancer. It can be, but we will not. When do we call this cancer? When it, from the skin, it goes inside into the muscles, it goes inside into the fat, goes and hits the bone. That is when it is called a cancer. So this is how a cancer is formed. So when you get hurt, you don't come to us. You then, it'll heal. When you feel a small lump, you're like, this is going to heal. So that is fine. But when the same thing goes and presses on other structures, like on the chest, it presses the bone, here it presses, disturbing your daily activity, daily work, causing pain or some pressure symptom or some other, abnormality, that is when you come to us. That is when you find out it is cancer. By then, this cancer would have spread somewhere, would have destroyed the tissues around it, would have destroyed another part. So the damage has already been done. So that is when patients usually come to us. That is when we stage them, what stage are you in, what happened. So to avoid all this, what do? That is why we have something called as a regular health checkups, lifestyle modifications, eat healthy, do not smoke, do not drink alcohol, don't do anything that the mankind is not made for. Regular health checkups are something now we're already fallen into the loop of, the daily hard work, get up in the morning, this, that. There's nothing we can do about it, but regular health checkups are a lifeboat. And when cancers come, and you come in an early stage, it is like any other disease. You give some medications or you just do a small thing. It's a very basic thing. But when you come at an early stage, it's easier for us to treat you and it's easier for you to recover and go back home. But if you come at a late stage, by then the damage has been done. The treatment we give, or the amount of surgeries we do also increases, and the recovery time for you also increases. It's a pain for you and it's a pain for us also to treat you. Say yes to regular health checkups. A healthy lifestyle, good diet is very, very important. And most importantly, because of our lifestyles, daily stress, hard work, the race to earn more money, the race to become successful, do not ignore what your body is telling you. Today you are fine, tomorrow you find something abnormal. Think about it. What has changed? What is it? Why is it feeling abnormal? Please rush to the hospital. Any change in the mole, any abnormal lump that was not there before, any small injury that is not healing, change in voice, loss of weight, someone tells you, you look weak, something is wrong with you, please take that seriously. These are all important early signs that you have not seen, but someone else has also recognized. That means something abnormal is happening. Your body is always communicating with you. It's always telling what to do, something is wrong. The pain, the fever, something different, or a small twitch. All this is the body telling you, boss, there's something wrong. So please take it seriously and respond accordingly. If you find anything unusual, any of this sort, do not wait. Book a consultation with us. We are the Speciality Cancer Care.